lesions, mainly dermatology, skin lesions and rashes, the history taking, as well as simulations. When my colleagues join, we'll be doing simulations from around 9:30 onwards for every other scenario. But firstly, we need to make sure that we can, and then we'll talk about the managements in details as well for each of the different scenarios. So that shouldn't be too difficult. I'm also going to teach you guys how to use the guidelines and different things like that for your preparations. Now, generally, when we're talking about skin lesions, okay, they tend to be around for a long time. And the difference between a skin lesion and some of the rashes, that rashes tend to present as a new rash. They tend to present as a new rash. So when something presents as a new rash, the time frame is going to be less than the skin lesions that we're used to. Skin lesions could be around for years. And so we tend to ask, what made you come now? But these rashes tend to come in the last couple of weeks, and they tend to be symptomatic in different ways, and they tend to have patterns. The key to diagnosing a rash or a skin lesion is to taking the necessary history. Both types of history are very similar, but you change the line of questioning when you realize that this is a long-term skin lesion and it could be cancer based on the age, for example. So we'll talk about that in a second as well. Skin lesions, they tend to be around for a very long time. The history taking in the beginning is asking them to describe the lesion. In these scenarios, they can be telephone conversations most of the time. And we said on day one, if you were here, that for telephone scenarios, what tends to happen is they may have already sent in some of the results. They may have already sent in a picture, or some examinations may have been done. And so when you come inside the scenario, inside your station, it's the telephone that's there, and maybe there's a clipboard with a picture of a lesion on the table. You still need to take a complete full history, asking about where is the lesion, the number, how many lesions are there, and how big are the lesions. Ask about the type of lesion. Is it under the skin or is it above the skin? And what color is the lesion? Again, we want to know if the color is the same as the skin and if it's the same throughout. Okay, and can you tell me about the color of the lesion, please? Yeah, it's dark. It's dark. Okay, and is it the same color as your skin? No. Is the color same throughout, or are there different shades, right? Pigmentation, shades. Oh, it's got different shades. From this, you can already tell this is probably a melanoma. So it's very easy to get the diagnosis by taking a simple, straightforward history. Ask about the shape as well. Regular, irregular in shape. Melanomas are irregular in shape. Some lesions are regular. And ask about whether or not it's scaling or flaking. Ask about any scaling, any flaking. So that's the beginning of your description of the lesion. One more time, skin lesions, they tend to be around for a long time. So people, when they present with a skin lesion, they would have had this skin lesion for years. Firstly, we want to know the location, how many lesions, and how big is the lesion? And is the lesion on top of the skin or is it under the skin? And what color is it? Doctor, it's kind of brown. Okay, I see. And is it the same color as your skin by any chance? No. And is the color the same throughout, or are there any shades or pigmentations? Oh yeah, it's the same color throughout. Okay. And in terms of the margins and the shape, is it regular or is it irregular? Oh, doctor, it's regular. Okay. And are the borders clear, or are they not so clear? They're quite clear, actually, doctor. Okay. And in terms of its appearance, have you noticed any flaking or scaling? No, doctor. All right, how long have you had the lesion for? I've had it for many years, 8 years, 9 years, many years. And did it appear suddenly or gradually? I can't really remember. I think it was just gradual. Okay, is your lesion getting bigger? Progression. You're using Odipara now. Okay, duration, onset, progression if it's getting bigger. And now, when you ask about progression, you also ask about symptoms of the lesion. Okay, does your lesion give you any symptoms? Do you get any pain, any itching, any tingling sensations, any bleeding at all? Have you noticed any discharge? So please take a notice of the open-ended question before the closed-ended questions. This will manage your time effectively. Does the lesion give you any symptoms? Yeah, it bleeds a bit when I touch it, doctor. Right, I see. And is there any pain? Okay, does it itch at all? And you mentioned bleeding. Is there any other type of discharge? And then the surrounding areas. If the lesion is here, I want to ask about any changes in the surrounding skin. Okay, any changes in the feelings under the skin. And now we cover any lesions or rashes or lumps anywhere else on the body. Have you ever had a rash in the past, or a lump or a lesion? Just a few questions that will help me understand things. Can I ask you about sun exposure? Have you been exposed to the sun in any way through your occupation or any other way, right? Do you tan yourself indoors or outdoors? You do need to take a good background history. We're reaching P. maftosa now. So between Odipara was initially to describe the lesion. When you got the initial description, what are we focusing on? The size, the site, the number, the size, the color, and the shape. Yeah? The site, size, the number, the color, and the shape. And the type is also important, but generally, even if you look at the picture, you can get it. Manage your time. Start open-ended. After you first find out the onset, duration, and progression. Is the lesion getting bigger? If you've done that, you're halfway through. Now you're going through symptoms. Symptoms of the lesion, surrounding areas, and any other risk factors. You can use a general cancer symptom systemic approach. Have you had any lightheadedness, any weakness? Are you getting tired easily? How's your appetite in general? Is everything okay? Have you by any chance lost any weight? Do you have any other medical conditions? When you're thinking medical conditions, you want to hear about things like immunosuppression. I have diabetes, or I have a comorbidity, rheumatoid arthritis, and I take methotrexate. That's immune suppression. Are you on any medication? When you said, do you have any sun exposure? You might remember now to ask, do you use sunscreen? Family histories. Do you have any allergies to any medication? Has anyone in your family, I'm sorry to ask you this, but has anyone in your family ever developed any sort of skin cancer in the past? Okay. May I ask, have you traveled abroad in the last 6 months? Sometimes they may live abroad, they may travel abroad, they may go sunbathing. Occupation-wise, may I ask what you do for a living? And does your occupation expose you to the sun? Now, if you ask your questions well, you're going to be fine because you just need to do your ice, right? Have you given any thought as to what this lesion could be? Okay, and is there anything you're worried about in regards to your lesion at the moment? Okay, and is there anything in particular you were hoping we could do about the lesion for you? Is there anything in particular you were hoping we could do about this lesion for you today? So that's generally how it goes. Yeah, that's generally how it goes. So again, thank you guys for joining, and we're just going to keep it going, isn't it? I would love to meet some of you guys and I would love to share the experiences, but right now we're going through the initial histories so that we're all on the same page of what a history taking looks like. And I'll summarize it at the end. We still have a rashes history to go through. Anyway, is there anything in particular you were hoping we could do about the lesion for you? Ask about the effects, okay? And has this lesion caused any effects in terms of how you feel about the lesion, your appearance, your self-esteem in any way? Good. Examination-wise, we look at the picture, okay? So I'm just having a look and I can see the lesion right now. It's like you described. You mentioned that it's got regular borders. Yes, I can see the size. Okay, so from everything that you've told me and having a look at the picture, I suspect that the cause of your lesion is A, B, C. So you took a good history and now you're going to explain what the lesion is and you'll have to go through management. So I'm going to walk you through common managements, okay? Common managements include having to refer to a specialist dermatologist if it's cancer, and we'll talk about those. And there's one station that you'll have to explain the options, and we'll talk about that when we see the scenario later as well. So in summary, for the first instance, when you have a lesion, please remember skin lesions, they tend to be around for a very long time. We're going to ask, all right, Mr. Johnson, can you tell me where the lesion is exactly? Oh, it's on my shoulder. Right. Okay. And how many lesions are there? Is it one or is it more than one? Oh, it's just one. Okay. And can you give me an estimation of how big your lesion is? I don't know. It's like maybe a couple of centimeters. Right. I see. And is the lesion below your skin or above your skin? It's above my skin. Okay. And is it the same color as your skin or is it a different color? It's a different color. Okay. And does the color change? Does it have any shades? No, it doesn't have any shades. Okay. And what about the borders? Are they clear borders or, and yeah, doctor, it's kind of clear. I can see the borders. And is the shape a regular shape or is it an irregular shape? Right? What's a regular shape? A regular shape is a circle, right? An irregular shape has maybe, it's not nice and smooth and homogeneous in shape. Yeah. Okay. Have you noticed any flaking or anything like that? Any scaling? No, doctor. All right. And how long have you had the lesion for? 8 years or so. Okay. And did the lesion appear suddenly or gradually? Is it something that was growing gradually? No, doctor. It appeared gradually. And is it getting bigger at the moment? No. Okay. Have you developed any symptoms at all? Does the lesion give you any symptoms? It itches sometimes, and I've noticed that lately it's been bleeding a bit more as well when I itch it. I see. Okay. And does it cause pain? No. Any changes in sensation? A little bit. Yeah. Okay. And other than bleeding, is there any other discharge? Or sometimes there might be pus or something like that. Is there anything like that? No. Yes. That's how it goes. Okay. Right. I just want to ask the surrounding areas of your skin. Are there any changes to the surrounding areas of your skin? No. Are there any changes just under your skin? No. Do you have any other lesions anywhere in your body or rashes or anything like that? No. Any previous lumps or lesions in the past? No, doctor. Okay. And a few questions about sun exposure. Are you exposed to the sun at all? Okay. And have you ever tanned indoors or outdoors? Okay. And just a few questions about, any general symptoms you might be feeling. Are you experiencing any lightheadedness or dizziness at all? No, doctor. All right. Any weakness on any part of your body? No, doctor. And do you by any chance get tired easily? No, doctor. Okay. And have you had any appetite loss? No. And have you noticed you've lost any weight recently? No, doctor. Okay. Just a few more general background questions. Thank you so much for answering. Do you have any medical conditions at all? No, doctor. Okay. And are you on any medication at the moment? No, doctor. Do you have any allergies to any medication? No, doctor. Is there any condition that runs in the family? I'm sorry to ask you this, but I do need to ask, has anyone in your family ever been diagnosed with skin cancer? No, doctor. Right. Have you traveled abroad recently in the last 6 months? Yeah. I went to Thailand. Okay. And in Thailand, what were the activities you were doing? Oh, I went to the beach. I was sunbathing. It was amazing. Okay. Did you by any chance use sunscreen? No. And other than the sunbathing, do you frequently like to sunbathe or tan yourself? Yes. Okay. What do you do for a living? I work as a construction supervisor. Okay, and does that include you having to stand out in the sun for long periods of time? Yeah. Now, I used to work in Australia. I used to work in China, and I was doing a lot of that under the sun. Right. Okay. Thank you so much for answering my question. Smoking, alcohol. Okay. Who else is at home? Okay. Have you given any thought as to what could be the cause of your lesion at the moment? I'm not too sure, doctor. Right. And is there anything particularly worrying about this lesion for you right now? Well, I mean, it's starting to bleed, so I'm just wondering, like, what's going on? Is it an infection? Okay. Well, sometimes an infection can cause bleeding, definitely. We're going to look into that. I'd just like to ask one more thing. In terms of your lesion, other than obviously sorting out the problem and finding out what's wrong, is there anything in particular you were hoping we could do about the lesion for you? Yeah, maybe remove it. I don't know. Okay. All right, no worries. Has the lesion, its appearance or its symptoms affected your life in any significant way that you feel is troubling? Well, I mean, it doesn't look nice, you know. Well, of course, you're right. It doesn't look nice. Um, wait. Don't say you're right. It doesn't look nice. Just don't say you're right. It doesn't look nice. Don't say that. Okay, I see, doctor. Okay, I see. Just acknowledge it. Yeah, just acknowledge it. Right. Okay, I hear you. I'd just like to now examine and have a look at the picture you sent in. Okay, and I'm just having a look at the picture, and I can see that it's about 2 centimeters in size, like you described. Yes, the borders are regular as well. So from everything that you've told me, and from the picture I'm looking at the moment, I suspect that what's going on could be that you have a type of lesion known as a benign mole, or if it's bleeding, so SCC, BCC, you might have to do the suspected cancer approach. And these are the scenarios now that we're going to do. Other than that, I need to give you a brief outlook on rashes as well. Okay. Some of the scenarios we'll be doing today will include rashes as well. So for the rashes, we want a description of the rash, just like we wanted a description of the lesion. The note I want to make to you guys is that rashes present usually as a new rash. They're not there for a very long time. Okay, so they present as a new rash. Okay, that started maybe a couple of weeks ago, a day ago, 2 days ago, after something. So again, where is the rash? Okay, and they may, when you say where's the rash, they might say, well, it was on my neck, but it's gone everywhere now. Right. So you need to make a note of that, a mental note. You don't want to find yourself, being lost as to what, right? If it started somewhere and it spread to other areas, generally you want to find that out. Okay. But if they give you this information, acknowledge it is what I want to highlight. So yeah, where's the rash? It's on my chest. Okay. And can you describe how big the rash is? It's quite big, actually. It's maybe like half my finger. Okay, I see. And what color is the rash? It's a bit red, but it's also a little silver. I don't know. Okay, I see. And Odipara. Okay. Did the rash come on suddenly or gradually? Oh, it came pretty sudden. And I just woke up and I found the rash, right? And how long has it been there for? It started 2 days ago. Okay, I see. And do you feel things are getting worse in terms of the rash? Yeah, I'd say that. Yeah. Okay. Has the rash changed in any way? Open-ended, right? We're going into symptoms and evolution of the rash. Again, open-ended. Has the rash changed itself in any way? Okay. You know, has it spread anywhere? If the answer is yes to changes and spreading and getting bigger, okay, and changing in color, you want to know the time frame. Over how many days? Okay, and so again, has the rash changed in any way? Yeah, I think it's getting bigger. Okay, you think it's getting bigger, and how many days do you feel it took to get bigger? In the last couple of days, it's been getting bigger. And has it spread anywhere? Yes. Okay. And how long after you developed the rash did it start to spread everywhere? Literally, by the end of the day, it spread everywhere, doctor. Okay. And have you noticed any color changes at the moment? Okay. Yeah, I've noticed color changes. Okay. And does the rash give you any symptoms at the moment? Have you, again, open-ended, right? Any pain, itching, okay? Any bleeding, any tingling, okay? Discharge as well, okay, blistering, ulcerations, scales, okay? And if there's any rash or ulcer in the mouth, it's very important. Sometimes these you have to ask about rashes or ulcers in the mouth. Good. Now we don't stop there. Rashes can have a prodrome. Rashes can have a prodrome. So ask, before you got the rash, were you unwell in any way? Did you have any fever, sore throat, any flu-like illness? Okay. If the answer is yes, right? So before how many days did the rash, before the rash, did you develop those symptoms? Good. Now, a red flag you should know about for rashes includes anaphylaxis. Okay, so you do need to cover, not all the time, but you may need to cover breathing problems, swelling, difficulty swelling, and chest tightness. Now, if it's a pediatric situation, on top of that, you should cover your common pediatric infections. The P in PAM-GUD, the P stands for pneumonia. Okay, the A stands for acute otitis media. Okay, the M stands for meningitis. So again, pneumonia is coughing, fever, shortness of breath. Okay, acute otitis media is going to be pulling at the ears. Is your child pulling at the ears at all? Okay, meningitis will be, is your child shying away from light? Okay, have you noticed your child is shying away from light? Definitely. Okay, a child can't really describe neck stiffness, but shying away from light, always just closing their eyes. Okay, gastroenteritis. Has your child had any diarrhea, vomiting? Okay, UTI. Okay, is there any crying when he or she is passing urine? Any crying when passing urine? Upper respiratory tract infection. You can ask it the same time you're asking about pneumonia, right? Any sneezing, coughing, or flu-like illness. And finally, D, dehydration. Ask about the child's fluid intake and feeding. How's your child feeding at the moment? How's the fluid intake? In pediatrics, we do that. In an older adult, we may do a systems review. Okay, have you noticed any headaches, any dizziness, any palpitations at all, any neck stiffness, right? Rash, we're in the topic of rash, guys. Meningitis is a red flag, right? So go in there, any neck stiffness, any shying away from light, okay? Any shortness of breath, chest pain, any coughing, any swelling in your glands around your neck. Have you noticed any swellings around your neck? Infectious mononucleosis, HIV prodrome, right? And then you keep moving down. Okay. All right. Any stomach upsets, diarrhea, constipation. Okay. Any nausea, vomiting, abdominal pain. Okay. Any urinary problems. Okay. Any joint pains, aches, pains, any joint pains and aches. Okay. Sometimes rashes in rheumatology can present, you're looking at things like potentially SLE in a young female. So just ask about joint aches and pains as well. So a systemic review will cover all the systems adequately for you to make sure you don't miss out on any important diagnoses. And it shows to them that you're a safe doctor. Obviously, a lot of talk about the approach, but hopefully when I show you guys as well, we can put it in 8 minutes and we can see how it's done as well. And we can learn from the experience. Anyway, is there anything you feel could be the cause of the rash? And is there anything in particular worrying you at the moment about your rash? Is there anything you were hoping we could do for you today? Now, you go for your PMAF-TOSA. I think for icing, generally ideas and concerns are the most important. In psychiatry, that's when expectations should come out earlier. So just to give you a tip there, when you're using your ICE, you can focus on ideas and concerns. Expectations sometimes in the middle, mainly psychiatry. Okay. So anyway, PMAF-TOSA time. In PMAF-TOSA, you need to cover immunizations. Yeah. So in your PMAF-TOSA, right, are you up to date with all your immunizations? Is also something to ask about. Because if somebody has a rash and they don't have their MMR vaccine and they describe the rash that's spreading and they had a flu-like illness recently, you already know where this is going, Okay, good. Other things that you shouldn't forget about, I was talking about the systemic review, and I think I told you most of them, but honorable mention, please, any swellings in your private areas as well, okay? Any swelling in your private areas as well. Good. Some rashes in the private area will definitely also need a sexual history. If somebody has, a rash or a swelling in the private area, you do need to take a sexual history. And there's some scenarios, which I'll tell you now, we usually, all the latest and newest scenarios in the 3-day masterclass, we run through them and we also simulate them. But what I'm going to tell you guys right now is that nowadays there's a scenario in which there is a 15-year-old girl who comes to you with, painless, a painless rash lesions, okay? And it looks like it's, genital warts, okay, which is symptomless and viral, right? The main DD is herpes. Herpes tend to be more painful, okay, but this is symptomless. And when you look at it, it sees that, but there's an added area that actually, because she's 15 and she's sexually active, you have to screen for abusive relationships, and the abusive relationship will be positive. She will have had a sexual relation with a male teacher who's at the age of 30 and, is her teacher. And so there's actually more to do in that station other than just taking a rash history. But we do these things again in today. We'll touch on that one. And we'll also have abuse scenarios coming down through the course during the full course that we're doing now and during the master classes as well. So I've given you a rundown of the different kinds of histories, but now we are going to spend as much as we can trying to simulate all of the different types of scenarios for today to give us an idea of how we can do it in the 8 minutes required. Okay, in the 8 minutes required. So let's try this out together. Okay. Dr. Nida. How are you?
I'm good. How are you?
I'm also okay. Thank you very much. So just need to set up my timer. Today, you're going to be my patient a lot of the time.
No worries.
Huh?
Yeah, I'm happy with that.
You happy with that?
Yeah,
How's the voice?
it's fine.
Yeah?
Yeah,
Audible and clear?
yeah, perfect.
Okay. We just need to move this around, get the timer going. Okay. Let me get this timer. So in this one that we can see all together, it's basically a 65-year-old woman presenting with a skin lesion known as basal cell carcinoma. Now, quickly, you can get a lesion on the back of the head, the face, the hairline, just to give you guys an idea there. We'll talk about the management in detail. But other than that, need to have a look so that you can simulate that as well. Okay. So usually when you enter these kinds of scenarios, the picture is already available when you enter, just so you know, yeah? Can we make it a telephone?
Just wait.
Yeah?
Yeah, just.
Mm-hmm.
Yeah.
Yeah. Okay. Into the room. Hello.
Hi, doctor.
Am I speaking to Samantha Smith?
Yeah.
Okay. My name is Dr. Radwan Ali. I'm one of the doctors calling from the GP surgery.
Yeah, hi, doctor. How are you? I was
I'm
waiting
good,
for
thank
this
you.
call.
I just want to confirm a few details if you don't mind.
Yeah,
Can
no
you
worries.
confirm your full name and date of birth and first line of address, please?
Yeah, it's Samantha Smith, and it's 24th of June, 1950, and it's 58 Hayden Road.
Okay, thank you very much. That's correct. Yes. Is it a good time to talk right now? Are you driving or by any chance doing anything?
No, doctor, I'm at home. No.
Okay, thank you. Okay. How can I help? I understand you had a few concerns, and I can see you've emailed in a picture of a lesion. Is that right?
Yeah, doctor, actually, there is a lesion at the top of my head.
Hmm.
Yeah,
On the
so
top of your head. Okay.
yeah.
Is it just the one lesion, or is it more than one lesion?
No, it's just one lesion, doctor, at the top of my head. To be
Okay.
honest, I can't see it, but my wife just mentioned to me.
Okay. So your wife mentioned it to you, yeah?
Yeah, yeah.
And when did your wife notice it?
6 months. She said like it's there for 6 months. Yeah.
Okay. So it's been around for around 6 months. Okay. And is the lesion itself growing under the skin or on top of the skin?
I don't feel, doctor.
Okay. Okay. Do you have any idea as to the color of the lesion at all?
Yeah, she told me, doctor, it's like mix of like a reddish in color, and the
Reddish.
boundaries are a bit different. Yeah.
Mhm. Okay, reddish in color. And is the color red all over, or are there different shades or anything like that?
No, no, all over it, doctor. Yeah.
Okay. And what about the borders of your lesion? Are they regular or are they irregular?
Uh, she told me like it's a circular, regular lesion. Yeah.
Okay, okay. And have you had any symptoms at all?
Like what, doctor?
Any sort of itching from the lesion?
Not like really, but sometimes it do. Not always.
Okay, okay. Does it bleed at all?
Yeah, doctor, it did once, but now it's fine.
So it did once, but now it's fine.
Yeah.
Okay. Is it painful in any way?
Yeah, doctor, it is quite painful now.
Mm,
Initially, it was fine, but now, yeah, it's quite
okay,
painful. Yeah.
okay. And have you noticed any changes in the sensation in the surrounding skin and the surrounding areas?
Not really.
Okay, okay. Is it getting bigger in any way?
Um, she said like, no, it's the same. My
Okay.
wife, yeah, she's the one who's noticing it every day, and she's quite panicking, and she's just
Yeah.
making me worried as well. I don't know what.
Understandably so. Understandably so. Okay, so by any chance, have you ever had any lesions in the past at all?
Now you mentioned, doctor, 3 years ago, I have a similar lesion at the back of my head.
The back of your head.
What they did with that, but I think they said that they freezed it and then it never came back.
I see, I see. So they froze it off, is it? Did they tell
Yeah.
you what the lesion was?
Doctor, no, I don't remember. No.
Okay.
Yeah.
Okay, just a few general questions to help me find out everything. Do you have any medical conditions at all at the moment?
No, doctor.
Okay, are you on any medication?
No.
Do you have any allergies to any medication?
No, doctor, not at all.
Okay, and I'm sorry to ask you this. Has anyone in your family ever been diagnosed with any type of skin cancer?
Uh, no, doctor, as far as I know. No.
Okay, and have you ever been diagnosed with the type of skin cancer before?
No.
Okay. And have you traveled abroad recently in the last 6 months?
Actually, doctor, not in the last 6 months, but I have been working in Australia, on the ship
Okay.
for my whole
Do
life.
you,
Yeah.
okay. Do you by any chance like to sunbathe or are you exposed to the sun in any way?
Doctor, I worked on the deck, so all time I was exposing
Right.
to sun, and then the weather of Australia, it's perfect
Oh
too.
wow. Okay. Yeah. So you worked in Australia.
Yeah, yeah, I worked for my whole life there.
Okay. Okay. So what do you do for a living, if I could ask? I wasn't so clear when you mentioned earlier.
Uh, Doctor, I am retired now, but I
Hmm.
was working in Australia on the deck for my whole life. Yeah.
Okay. 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 I see. I see. Did you use sunscreen when you were exposed to the sun before?
Never, doctor.
Okay. All right. And any other lesions anywhere else on your body by any chance?
No.
Okay. And any symptoms such as weakness, tiredness?
No, doctor.
Okay. And have you been by any chance been losing weight or anything like that?
No.
Okay. Thank you so much for answering my questions.